Bismillah ar-Rahman ar-Rahim. We'll be talking about the sexually transmitted diseases, the determinants, and the risk factors. Let's see or look at what WHO telling us about these factors and these infections. More than 30 different bacteria, viruses, and parasites are known to be transmitted through sexual contact. 8 of these pathogens are linked to the greatest incidence of sexually transmitted disease. Of these 8 infections, 4 are currently curable: syphilis, gonorrhea, chlamydia, and trichomoniasis. The other 4 are viral infections and are incurable: hepatitis B, herpes simplex virus, HIV, and human papillomavirus, HPV. So symptoms or disease due to the incurable viral infections can be reduced or modified through treatment. STIs are spread predominantly by sexual contact, including vaginal, anal, or oral sex. Some STIs can also be spread through non-sexual means, such as blood or blood products. Many STIs, including chlamydia, gonorrhea, primarily hepatitis B, HIV, syphilis, can also be transmitted from mother to child during pregnancy and childbirth. A person can have STIs without having obvious symptoms of disease. Common symptoms of STIs include vaginal discharge, urethral discharge or burning in men, genital ulcers, and abdominal pain. More than 1 million sexually transmitted infections are acquired every day worldwide. 1 million. Each year, there are an estimated 357 million new infections with one of 4 STIs: chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 5 million people are estimated to have genital infections with herpes simplex virus. More than 290 million women have a human papillomavirus infection. The majority of STIs have no symptoms or only mild symptoms that may not be recognized as an STI. So STIs such as gonorrhea and chlamydia are major causes of pelvic inflammatory disease and infertility in women. STIs such as herpes type 2 and syphilis can increase the risk of HIV acquisition. Over 900,000 pregnant women were infected with syphilis, resulting in approximately 350,000 adverse birth outcomes, including stillbirth, in 2012. In some cases, STIs can have serious reproductive health consequences beyond the immediate impact of the infection itself. For example, infertility, mother-to-child transmission. Drug resistance, especially for gonorrhea, is a major threat to reducing the impact of STIs worldwide. And HPV infection causes 528,000 cases of cervical cancer and 266,000 cervical cancer deaths each year. What about the cost? The total lifetime direct medical cost of the 19.7 million cases of STIs that occurred among persons of all ages in 2008 in the United States was $15.6 billion. In details, chlamydia, 560 million, gonorrhea, hepatitis, HIV, human papilloma, herpes, syphilis, trichomoniasis. So it's very costly and it's a problem, bigger problem in the United States. So what are the risk factors and determinants of health and disease in genital urinary problems, sexually transmitted infections, pelvic inflammatory diseases, urinary tract infections. What are the risk factors? Risk factors are anything which is known to affect or perceived as likely to affect the frequency of occurrence of a disease other than its direct cause or causes. While the determinant is anything which causes the disease, etiology, or predisposed to disease, protects against the disease, prevents the disease from occurring, or anything which affects the frequency of occurrence of disease. Let's talk about the risk of STI transmission. Increased susceptibility to STI infections among women. Let's see, women bear much more risk compared to men. This is because of two factors. Biological susceptibility. They are more susceptible because of their biological and their physiological, biological, anatomical. Increased susceptibility in younger women. Increased proportion of columnar epithelium lining the cervix in young women. This kind of epithelium is particularly susceptible to STIs infections, especially gonorrhea and chlamydia. So with maturity, the columnar epithelium is replaced by squamous epithelium that is less penetrable to infection. While the vaginal ecology, also the concomitant pH and the presence of the resident flora. As female progress through adolescence to adulthood, developmental changes involve replacement of endogenous vaginal flora, predominantly characterized by enteric organisms and a basic pH, to an environment that's predominated by lactobacilli and an acidic environment that is hostile to many STI pathogens. So, when we look at the post-adolescence and adulthood, the changes will increase thickening of cervical mucus, which is less permeable to STIs or STDs pathogens, and will harbor immunological defense, such as white cells and antibodies. In adult women, presence of bacterial vaginosis, for example, by Candida, will alter the healthy vaginal ecosystem and cause a reduction in the bacilli that produce hydrogen peroxide, increase in pH, resulting in favorable environment to STDs associated pathogens. So, gender differences in anatomy. During intercourse, the exposure time of semen in the vaginal cavity is risky to women more than exposure of female secretions to male genitalia. And menstruation represents a risky period for transmission. The cervix becomes open, mucus is less with less thickness, may account for high rates of upper genital tract infection. During pregnancy also, women are more susceptible to STIs infections, especially HPV and genital herpes. Behavior susceptibility, gender imbalance, and socioeconomic factors. Gender imbalance, men make more decisions about the protection, condoms, or abstain from sexual activity. Socioeconomic factors increase the risk: crowded population, poverty. Also the cultural and religious factors. Some cultures encourage the premarital sex, legal or illegal prostitution. The religion is the most protective factor among all, especially that all religions prohibits the premarital or extramarital sexual relationships. It's obvious why. Healthcare seeking behavior is less frequently among women when it comes to STI infections. Women are more asymptomatic, which may delay seeking care, which is a risk also for PID. Let's talk about chlamydia, gonorrhea, and syphilis. Chlamydia, the most common reported bacterial sexually transmitted infection in USA. Among women, of course, male-female ratio 50 to 350. Biological risk: adolescents very susceptible to recurrent infections, cognitive immaturity, peer pressure. Chlamydia infect columnar, not squamous cells. Older women have previously infected, acquire immunity, and also the behavioral risk. Gonorrhea, male to female, 50 to 350. Also among the young group, 15 to 19 age group, previously infected, immune, higher male to female infection, 90%, compared to 30 female to male infection. Drug abusers, poor access to health care. PIDs, inflammation of the upper reproductive tract, including the tubes, ovaries, and the endometrium, results of ascension of microorganisms, mostly chlamydia and gonorrhea, from lower genital tract. 70%, 25 years old or younger, highest among sexually active teenage, crowded, single, divorced, young age, multiple lifetime sex partners, contraceptive users, cigarette smoking. UTIs, higher among women than men, increase with age. Bacterial movement periurethral facilitate ascending to the bladder. Frequent intercourse, younger age, at first intercourse, abnormal or unusual sexual behavior, anal vaginal transmission, pure UTIs, oral contraceptives, premarital extramarital sexual relationships, frequent antibiotic use, exposure to genitalia to non-hygienic environment, and exposure to cold. Thank you.